Next question is from Joseph. One of the things he's interested in is the growth of third-party patient-facing FHIR-based applications. How do you see this ecosystem growing? Don Rucker always talks about this as an aim when he was at ONC. And how can patient-facing applications position themselves to take advantage of the info blocking interoperables and advancing FHIR standards? So
Yeah, it's a really good question. You know, I actually think that there's really intriguing things that are coming out of the patient-facing application. I think back to my time at Cerner, and like we were running the Open Developer Experience program. It was like, okay, we're building an app ecosystem for people that are focused on apps for clinicians. And it's like all these people showed up and were like, hey, we're going to build a patient-facing app. And I'm like, okay, but it's just not a muscle that I think many of the EHRs are like super comfortable with and super well versed. So the advent of the third-party patient-facing apps coming in, getting public access to healthcare entities' endpoints, providing an identity framework, and the ability for patients to choose their apps, I think is a really like beneficial and positive turn for the industry. The other interesting thing about it is you're starting to see that the influence of those folks showing up and consumers actually using them propagate into other areas. So you've got the recent, you know, kind of nudge on the payer side for patient access, making my claims data available to me. So I think like you're getting this interesting friction, which on the provider and payer side, I don't always know is like financially and incentively aligned. But the advent of the third-party patient-facing apps is definitely seeming to put some pressure on making the data more available and ideally available through a FHIR-oriented standard. And I think what you're going to find is as consumers get more savvy, they download more claims apps and they get a little better understanding of what price transparency looks like. And you see CMS pushing price transparency down, issuing fines, warnings to hundreds of healthcare systems about some of their pricing practices. I think what you're going to see is like, actually, I need to know even more about helping me make my decision of provider one versus provider two, what my outcomes might be at provider one versus provider two. So I think the more consumer adoption in a way will actually influence like a greater adoption of the standard and an expansion of the standard to cover more things. You know, I think there's the last point on that is like, there's this really interesting focus in the industry right now on social determinants of health and like stats that, you know, pick a high percentage number. There's studies all over the place that say like a high output of your like actual physical well-being can be determined just based on the zip code that you live in. And like, there's a really interesting and needed push towards healthcare equality and outcomes. And I think the more direct to consumer apps that show up and put the power of the hands in the consumers, you're going to see the ability and the need for the FHIR standard to codify more of that social determinants of health data in a way that's translatable and puts an overall profile of like how to transition and how to care for this patient in a better fashion. So long-winded answer, but hopefully covered what Joseph was trying to ask as far as my perspective on that.
Yeah, totally. Joseph, let us know if that didn't hit the mark, but absolutely. And I'm personally super excited about the social determinants of health piece. Before I was here at Redox, I was in the public health space, and just lots of exciting things coming our way soon, hopefully in that space.